Hey ladies, it's Dr. Susan, and I want to talk to you about a very sensitive and important topic, which is vaginal dryness and pain with intercourse around the time of menopause. So, painful intercourse and vaginal dryness are an absolute deal breaker to a great sex life. Let's face it, we are animals and pain causes us to withdraw. So this is not a great position to have sex in. We want to be involved and into it. And if it's going to hurt, we're going to naturally draw away. So why does sex start to hurt? Well, vaginal dryness and painful intercourse are symptoms of low estrogen. So there's generally things that we start to get right around the time of menopause and in the years after menopause when we've stopped having a period, or in the final years of our period when our estrogen levels are starting to drop. Now, we've talked before about how during perimenopause estrogen levels are still present, but they fluctuate a lot. So there are periods of time when they're quite low. And some patients are very sensitive to those low estrogen times so that the vaginal tissue actually starts to get thinner and drier, and it doesn't stretch as much. So you might have heard me talk before about the puffy donuts and the sandpaper, but I'll tell you again because it's a good image. When we biopsy the tissue of younger women who are still making tons of estrogen, the vaginal tissue, those cells actually look spherical. They look like puffy donuts, look like jelly donuts. They've got fluid in the middle, they're thick, they're resilient, they're stretchy, they look like you could jump up and down on them, they look fun and playful. And that's when sex was fun, when everything was working and you could stretch it and it was moist and all yummy and juicy. Now, if you look at those same cells in a patient who hasn't had any estrogen in their system for a little while, those puffy donuts flatten completely and look like paper. They're thin, there's no moisture anymore. Because of that thinness, there's no resilience. So when you stretch the tissue, it literally can break. So I sometimes think about getting a piece of tissue paper and pulling it. And I'll do this in the office when we're talking about vaginal dryness and pain. If you pull a piece of tissue paper, it cracks. It doesn't stretch. Whereas if you pull a jelly donut or a piece of chewing gum, it's going to stretch. And we used to be able to put a baby through the vagina. It's got the potential to be enormously elastic, but without any estrogen, that elasticity totally disappears. So then when we're having intercourse, ouch, like it's pulling, it's tearing, it's not stretching. And without the moisture, obviously, there's a lot of friction. Now, we can use lubricants, which is a great idea in the short term, but that is really just putting moisture over unhealthy tissue. So it's a Band-Aid, and it's appropriate for a short time. But what I like to do is cause your own tissue to produce its own moisture again. So we don't have to use lubricants. If we use estrogen, we can actually turn that flat paper, sandpaper-like tissue back into a jelly donut. And it's incredible that that actually happens. Biopsy proven. Same tissue can flatten out, and then with estrogen can grow again so that it has that resilience and stretchiness. And, we really want to enjoy our sex lives, don't we? Sex used to be fun. Then it goes through a period of time for most of us of being work. And worse, it can turn into being painful. So it's something that we actively avoid. But it's such an important part of our intimate lives. In my opinion, if we can get that back, we need to do it. We're going to live to be possibly 100 years old. And I personally plan to be sexually active as long as I'm alive. So we've got to keep that vaginal moisture there and got to make it pain-free. So the key to producing moisture and getting rid of vaginal pain is estrogen. We can put estrogen directly in the vagina. There's several forms that are available of bioidentical plant-based estradiol. It can be in a cream form. There's even a little ring that can be placed inside the vagina that delivers estradiol over a 3-month period. There's also a little dissolving tablet. All of those work equally well depending on what you prefer. And then giving estrogen throughout your whole system in the form of a pellet, a patch, whatever your provider prefers, is going to deliver a little bit of estradiol to the vagina, but sometimes not enough, and it can take a long time. So if we think about those sandpaper cells, they're not healthy cells, and we've got to get rid of those and replace them with healthy cells. So when we start you on estradiol in whatever form, we need several cell cycles to turn over in order to get rid of that dryness. And so that could take months, and it is frustrating. It can take 6 to 12 months for vaginal dryness and pain to go away with estrogen therapy. Now, it will go away, but I'm really impatient. I don't know about you. I don't want to wait 6 to 12 months for anything. So another option to help to move things more quickly is to do vaginal laser. And we've talked about that quite a lot, but I'm so excited about it. I'll just reiterate that vaginal laser is the quickest way to get through vaginal dryness and pain. There's lots of information about it on our website, but to make the story shorter, a little probe is placed in the vagina. It's not painful. We use a topical local anesthetic. You can drive yourself to and from the appointment. I use an erbium laser, which is called Juliet, but there are other products out there. The laser punches tiny little holes in your tissue in concentric circles. And in doing so, it brings your own body's stem cells and growth factors into play to help to make that cell turnover quicker. Just like if you lasered your face, you go through a dramatic peel and all of a sudden you have beautiful skin. When we laser the vagina, it just makes that process a little bit quicker so that you don't have to wait so long. So most of our patients, even after one treatment of laser, are having dramatically improved moisture. And after 3 treatments, which is the recommended cycle, 1 treatment a month times 3, so 3 treatments, the dryness is gone. So for most patients, that's completely curative. And along with estrogen, if you're a patient who's able to take estrogen, problem solved. But it's not going to go away by itself. And our culture might teach us that we don't have to have sex anymore as we get older, that, we're old now, we're irrelevant. But I completely disagree with that. We are sexual beings, and our sexual being is part of who we are. So to live in our full aliveness, we want to keep our sexual being alive, and keeping the vagina healthy is critical. So think about that. Ask me more about it if you want to. If you have questions about vaginal dryness, pain, or anything to do with sexual function as we get older, you can submit a question to drsusan.com/ask. That's drsusan.com/ask, and we'll possibly be able to answer your question on our YouTube channel live. In the meantime, do some research, get on your estrogen if you can. Testosterone is also helpful, but estrogen is the mainstay, and vaginal laser is the best. So call me up, we'd love to do it for you. And then we can talk more about how we use that in conjunction with platelet-rich plasma, but that's more for another time. I hope you've learned something today, and I can't wait to talk to you again soon.